Orthopedic surgery is a great field for men and women. We get the opportunity to see immediate gratification for what we do for our patients.
I think that the vast majority of people I know who chose orthopedics are really glad they did it.
One of the really cool things about orthopedics is we get to take care of people of all ages, both sexes, all kinds of problems, the whole body, hands, arms, shoulders, legs, hips, backs. We are never bored. And when you meet orthopedic surgeons, if you contrast us with other specialties, you'll see that we're some of the happiest people in our work that you could hope to meet.
Orthopedic surgery is a great field. It's really satisfying. You can really help people, and it helps you too. It is it's one of the best decisions I've ever made in my life. Going to work every day is not like a slog. It's a pleasure. It's what I would do and what I would choose to do if given the choice again.
I actually didn't discover orthopedic surgery until I was a medical student, but I'm so glad that I did, and it's a very diverse career. You get to see so many different types of things in the musculoskeletal system. You don't just work with bones, you can also work with the muscles, the tendons, lots of soft tissues. You can do anything from a joint replacement to a carpal tunnel release to spine surgery.
It's something that I chose because I could work with my hands, like putting puzzles together, or I grew up sewing and knitting and doing embroidery as well as playing those sports. And I love that stuff. And orthopedics has the carpentry that people talk about, but it has the embroidery and the fine attention to detail that is very artistic.
My mom actually did a lot of carpentry work, and I thought it was the neatest thing ever. And I always liked to help people and things like that. And one day I was playing soccer and they thought I hurt my knee. And I went into my friendly orthopedic surgeon's office, and he allowed me to actually shadow him in the OR. And I went into the operating room, and sure enough, he had a craftsman's tool chest sitting over in the corner, just like my mom and my uncle had. And it had on it Dr. Smith's toy chest. And I was sold.
I enjoy everything about my job. I gotta say though, I love the OR. I really love the OR. I just can't get enough of it. I'm bouncing around like a little kid in a candy store sometimes, when I'm in the OR.
I love taking care of patients in the clinic. So I love talking to patients about their disease. I love talking to patients honestly and frankly about end-of-life care, so people who have metastatic disease and are dying. I have no qualms about engaging in those discussions, and it's incredibly rewarding, and it's a privilege to be involved in care of patients at that stage of their lives.
Orthopedics is a great specialty, and there's so much innovation and excitement, but it's the people that you get to work with day in and day out that make it a very special career.
When I decided to go into orthopedic surgery as a medical student, I had simply approached people that I had met along the way that I admired for various things, their intellectual prowess, their, the compassionate care they provided their patients, whatever it was. I simply went to them and said, I'm considering a career in orthopedic surgery, and I was wondering if you could sit with me for a few minutes and tell me what that means. What do I do from here?
If you come to them and say, you're someone who I admire and I want to be like, and I'd like to do what you do in the future, can you tell me how you got there? And just those simple first steps really can forge the way for a very, very nice and long-lasting relationship from a mentor.
People in other specialties who didn't know much about what orthopedics was about didn't take me seriously when I said I was interested in orthopedics. They told me that I was too small and that women don't go into orthopedics. I still remember sitting in Dr. Peabody's office and asking him if this was true. Was I too small to be an orthopedic surgeon, or were women not respected in orthopedics? He said no way. He said I would have to be smarter about how I did things because brute strength wouldn't be an option for me. I found this to be true, and you really shouldn't be using brute force on your patients anyway.
I think that a lot of women don't really think about orthopedic surgery, either because they haven't been exposed to it, or maybe more so in past years, they've been discouraged from entering the field for certain myths that perhaps women can't do this type of work. And that's just simply not true.
Orthopedic surgery is not just about carpentry or drills. So if you haven't had a drill in your hand or a screwdriver in your hand, doesn't mean you can't do it. I did not grow up like that. I liked ballet, dance, and clothes.
I hope that women watching this don't feel like they really need to question the decision if they're thinking about it. I think if you like puzzles, if you like working with your hands, if you don't mind blood and guts and a lot of blood sometimes, definitely do ortho.
In terms of choosing orthopedics as a career, there's many myths out there. It's time to get all the myths busted. You don't have to be large, you don't have to be a jock. You can do orthopedic surgery if you want, no matter what your size, as long as you have the desire to become an orthopedic surgeon.
You need to be compassionate, care for your patients, develop technical skills, and have all the cognitive abilities that you need to do complex diagnoses of musculoskeletal problems. And that's totally gender nonspecific. And so women are welcome in the field and they're needed in the field.
We in orthopedics are used to having the top 10% of the class, and if half the class is women and we don't attract women in orthopedics, then the field is going to suffer.
Women bring great strengths to the field of orthopedics. Different than men in many ways, but equal. Women can collaborate, think about problems differently, and really bring a lot of talents to the table.
There are far fewer women of color in orthopedics, but don't let that stop you. I mean, plenty of people have done it before. Seek out those mentors and successful orthopedic surgeons who look like you, and talk to as many of them as possible. Hear their stories, and you'll find inspiration to be successful.
It's really a fabulous surgical field. It has lots of opportunities. I think you'll find it extremely rewarding, and anyone who tells you that it's not a good profession for women, do not listen to them.
If you like people and you like science and you like technology, orthopedics is the field for you.
The most important thing is to really find what you're passionate about, because if you're passionate about something, it doesn't seem like work.
It's a great thing to find what you love and are passionate about, and something that not everyone is lucky enough to find. So when you do find it, go for it.
I would say go after it hard. You have to work your you-know-what off, and be passionate about it.
Jump and the net will appear. Meaning, if you want something and you don't think you have the tools or the equipment, but you have the dream and you're passionate about it, you'll find a way.